Welcome back, Focus Learners. Today, we're diving into something super important. Look, heart disease is the leading cause of death worldwide, which, yeah, can sound pretty daunting. But did you know your plate is your most powerful tool? It's true. We can proactively fight this condition right from our very own kitchens. In this explainer, we're taking the power back. Let's look at the science-backed foods that actually protect your ticker.
We aren't just talking about abstract, confusing medical concepts today. We're literally handing you the keys to your cardiovascular health, all based on proven science from places like Harvard Health and the University of Wollongong. It really comes down to what you put on your fork.
So here's the roadmap for our ultimate plate tour. First, the handful rule. 2, greens, berries, and avocados. 3, healthy swaps and garlic facts. 4, the dietary no-go zone, and 5, the gold standard heart diets. Let's jump in!
Starting off with Section 1, the handful rule. We are unleashing the cardioprotective power of nuts.
Okay, so we're looking at some incredible recent research from the University of Wollongong. The magic number here? 30 grams. Did you know eating just 30 grams of nuts a day, which is about a handful, can significantly reduce 6 different risk factors for heart disease? It's literally that simple, but surprisingly, only about 2% of people actually hit this daily target.
And when you do hit that target, the protection is completely next level. That single handful of nuts helps lower your bad LDL cholesterol and your total cholesterol, plus triglycerides and a tricky LDL building block called apolipoprotein B. Oh, and it also lowers your blood pressure while increasing your blood vessel flexibility. It's basically a full-body shield for your heart.
Now I know exactly what some of you are thinking. Wait a second, aren't nuts super high in calories? Well, let's go ahead and bust that enduring myth right now. Overwhelming evidence shows that eating regular, unsalted nuts provides all these massive health benefits, like lowering that bad LDL cholesterol and blood pressure, completely without the risk of weight gain. So yeah, it's an absolutely safe, heart-healthy choice.
All right, moving right along to Section 2, greens, berries, and avocados. This is all about the foundational power of fresh produce.
So Harvard Health data is crystal clear on this. Vibrant produce is your best friend. Seriously, don't skip the leafy greens. Veggies like kale, spinach, and bok choy are incredibly high in nitrates, which act like little chemical messengers that help relax and widen your blood vessels. They literally improve your blood flow naturally.
And just how effective is that? Well, research shows that eating these nitrate-rich vegetables can lower your risk of cardiovascular disease by up to 26%. Honestly, that is a huge return on investment just for, eating a salad or sautéing some spinach with your dinner. Next up in the produce aisle, we've got berries. Strawberries, blueberries, you name it. Berries are packed with powerful antioxidants that fight inflammation. They essentially create this microscopic defense shield around your heart and arteries, neutralizing oxidative stress before it can cause the kind of chronic, artery-damaging inflammation that leads to heart disease.
And for all the avocado lovers out there, I see you. You are absolutely going to love this stat. Eating just 2 servings of avocado a week has been linked in studies to a 21% lower risk of experiencing a heart attack or a related coronary issue. They are just loaded with the healthy fats, fiber, and crucial micronutrients your cardiovascular system thrives on. Let's head over to Section 3, healthy swaps and garlic facts. We're flavoring your heart health with smart choices.
This is where we get to be smart about everyday ingredients so we don't feel deprived. For cooking, you want to switch those solid fats, like butter or tropical palm oils, for liquid plant oils like olive oil, which is loaded with heart-healthy monounsaturated fats. Plus, olive oil is packed with antioxidants that actively protect your arteries from damage. Such an easy swap, right?
And then there's your protein. You should definitely aim for the omega-3 upgrade. Also, aim for 2 to 3 servings of oily fish, like salmon, mackerel, or sardines, every single week for those crucial omega-3s. These fatty acids are absolute rock stars at lowering dangerous inflammation and significantly reducing the incidence of heart failure.
Now what about flavor? We've all heard the folklore about raw garlic fighting off everything from a common cold to, well, vampires. But clinically speaking, scientists have developed aged garlic extract, or AGE. By aging garlic for up to 10 months, it actually becomes completely odorless and highly bioavailable. A recent meta-analysis showed that AGE has twice the phenolic content of fresh garlic, and this significantly lowers your blood pressure and arterial stiffness. It's a true clinical powerhouse.
Which brings us to Section 4, the dietary no-go zone. What to minimize on your ultimate plate.
Look, poor diet quality is directly tied to an elevated risk of heart disease. So to keep your heart happy, try to minimize added sugars, high sodium foods, and processed meats. You really want to steer clear of highly processed stuff and high-fat dairy whenever you can. Instead, stick to minimally processed whole grains for that essential fiber, along with lean proteins and all those vibrant plants we just talked about.
Wrapping things up with Section 5, Gold Standard Heart Diets, bringing the big picture together.
When you put all this together, what does the perfect plate actually look like? Well, the DASH and Mediterranean diets are the gold standard for heart health. The DASH diet is completely focused on stopping hypertension by loading up on veggies while severely limiting sweets and saturated fats. The Mediterranean diet is a plant-forward way of life built heavily on olive oil, nuts, and fish. Both of these are just incredible blueprints for your ultimate plate.
And as we close out this explainer, I really want this to sink in. Small changes today lead to a longer, healthier life tomorrow. You honestly don't have to overhaul your entire life overnight. Just adding a handful of nuts or using olive oil instead of butter are massive, massive wins for your heart.
So let me leave you with this question to ponder. What is the very first heart-healthy swap you will make on your plate today? Maybe tossing a little spinach into your breakfast or grabbing 30 grams of walnuts for an afternoon snack? The choice is entirely yours, and I promise your heart will thank you for it.
Just a quick note before we go. Important disclaimer. This content is for educational purposes only and is not a substitute for professional medical advice, diagnosis, or treatment. Always seek the advice of your physician or other qualified health provider with any questions you may have regarding a medical condition. Thanks so much for joining me on this explainer, focused learners. Stay curious, stay healthy, and I'll catch you next time.